Let's continue to get reactions, though, to this report by the Office of the Health Standards Compliance released today. It's revealed serious contraventions of the prescribed norms and standards regulations for quality and safety and various other applicable laws aimed at ensuring safe and quality healthcare services. This is just at the Helen Joseph Hospital. Let's speak now to Rich Sicina, who is, of course, speaking to us as part of the Health and Allied Workers Indaba Trade Union. Thank you so much for speaking to us, Richard. Good evening to you. I mean, your reaction to this report, is it a well-qualified report into the state of Helen Joseph and also a great example of our health facilities?
Thank you very much, Naledi. Good evening to yourself, your team there, and also the viewers at home. It is a well-qualified report, and exactly it is a reflection of what is actually happening in all our healthcare facilities, public sector in particular. Things are dire, Naledi. I want to tell you now, I'm doing bedside nursing. Every day I'm on duty. I know what is happening on the ground. And I hear Prof saying maybe we need to hire senior people in positions of authority. But when you zoom closer to how things are run, in particular here in Gauteng, the budget, Naledi, is centralized. It is controlled in central office, in Gauteng Department of Health. And CEOs in different facilities, no matter how qualified and patriotic is that particular CEO, all of them are presiding over institutions that they don't have control of the budget of those particular institutions. At the moment, now as we speak, we don't have plastics, we don't have bread. We are going into our own pockets. There is no, at the moment, like it's CEOs are sent into facilities to say, make that particular facility work. Let me make an example. There are people who retire, some of them die, some of them resign, others are dismissed, and those people are occupying posts that are funded. But as we speak now, we are all waiting for financial year in April. There's no money in terms of cash flow. There are certain facilities now that have actually, we have millions of money that went back to the coffers of provincial treasurer, from Telemo, Liratong, Paragonat Hospital, because those monies were never utilized for different reasons. But as we speak, those monies are nowhere to be found. The system is we are borrowing each other now. There's no money to actually pay those guys who are delivering bread to our facilities. There is no money for overtime. Buildings are dilapidated. It's even difficult now, Naledi, to fix a handle, the door handle in our facility. So who do you blame here? Because the budget is centralized. Even if you can hire the most qualifying patriotic CEO who's going to call and talk to us as workers on the ground and make sure that we go out there, excel and produce quality. But what do you do, Naledi, if you have gross shortage of staff and gross shortage of material resources? You
know what the health minister talked about today was the salary negotiations happening at a national level. So, you know, even the calls that are being made for Treasury to allow for more resources to go into the Department of Health so that there is infrastructure maintenance and the employing of more staff. But the issue that you're raising is the centralizing of the budget. So the money certainly could come in from the finance minister on Wednesday, but the concern is, will it reach the various hospitals? Let's take a look at a few WhatsApps that have come in on this discussion. 072-110-5584 as we respond to the Ombudsman's report into the state of Helen Joseph. In a moment for us to reflect on other health facilities. Anonymous says, I took my father to Mahikeng Provincial Hospital in December 2024 after suffering a stroke. I was told to stand in line before opening a file. I tried to explain to them it's an emergency and the patient is in the car. They didn't care until I called the CEO. That's when they started to take me seriously. In Mahikeng Provincial Hospital, you need to know someone before they help. I even had to help myself to take him out the car. No wheelchairs. I had to use the bed. That's a horrendous position to be in. Anonymous, thank you so much for joining us. What if you don't know the people in power? Selema Chokwe says, The nurses and doctors treat patients like outcasts. Complaint about a staff member is treated as refusing treatment and you are immediately discharged. A hopeless situation. Salema, thank you so much for that. Let's see, one more. Spiwe Ngube says, mixed experience. I was admitted at South Rand Hospital for the delivery of my baby boy. The nurses neglected me overnight until the doctor came the next morning and said the baby was tired and I needed an emergency cesarean procedure. Goodness. I was taken to Charlotte Maxeke by ambulance. From the moment I entered the ambulance until I walked out of Charlotte Maxeke after delivery, I was treated like royalty. Okay. Though I passed out during the Caesar, the doctors did everything in their power to save mother and child. I'm a happy mother of a 9-year-old boy. Spiwe, that's a positive story, and we're glad for that as well. Yeah, so those are some of the WhatsApps. I mean, Rich, talk to me about what you want to hear from the Finance Minister on Wednesday. Calls are going to be made by the Department of Health for more resources to go into our hospitals. But is it really going to fix the problem?
Not necessarily, Nalet, because we have already told, by the way, these politicians in particular, when they get an opportunity to speak on the public domain, it's so frustrating because you'll hear the Minister Mzwaledi complaining like us. You'll hear the NEC complaining like us. No one is coming up with a solution to say, what are we going to do? It's just lamenting and lamenting. For example, what they will call for more resources, but we've been told already that the hike compared to the previous budget is going to be about 5% in terms of how each and every hospital is going to get that particular budget. And we have already looked into how much is it going to, that particular budget is going to go into salaries of employees. Since we are going to get 5.5 a wage hike, already now it's the budget for financial year 2024-2025, by January it was depleted. And we are expecting to say this year by November we won't be having money because there's not much of a difference the budget is going to make. Remember, we already have accruals. We already have service deliveries who are delivering stock to us, material resources and stuff like that on debt. We're still going to look into that particular budget and start by paying that. Some of us in our facilities, we have nurses, doctors, and other workers who have worked overtime because of the shortage of staff. By April, we need to start. When this budget comes into our pocket, we have like about billions of money that we have to pay accruals first. Then already we're in a dire situation, and in the absence of the best, mediocre becomes the best. You will work with that particular skeleton staff. Those of us, people from different locations, who are from poor backgrounds and who are beneficiaries of public healthcare system, are still going to suffer. All I'm saying as a unionist is workers on the ground. I've never seen anyone, Naledi, taking the employer, the politicians to court to say that gross shortage of staff and gross shortage of material resources is killing workers on the ground, not only the morale of workers, but it's also killing poor, innocent souls on the ground. It's not nice for us as well, Naledi, to go out there knowing that our existence is to save lives, but you go there and you are hopeless. Then patients die as easy as that, and politicians don't care.
Sure. Rich Sicina there, he says, in some cases at these health facilities, the staff are buying bread for patients out of their own pockets. They're running out of plastics, digging into their own pockets to bring some of these resources into the facility. Let's see some of the WhatsApps, perhaps just two more. Let's see, Tembam Tembu says, a nurse friend advised me to go to Dr. Yusuf Dadu Hospital in Krugersdorp for a dental procedure. I went there today and the service was excellent. The attitude of young doctors, unbelievable. I'm going to write a letter of appreciation to the minister. So good to hear that there is positive feedback as well that's being given to us. Anonymous says, I went for a hernia operation in December 2024 after waiting for almost a year. Was booked in for a whole week before getting the operation because of a lack of space. Before operation, doctor was playing Candy Crush and did not even scrub in. Goodness. Sitting now with huge complications. That's our lives. That's the reality. of where we are. Well, we're going to take a quick call. Anonymous is on the line. Anonymous, good evening.
Good evening, how are you?
I'm well, sir. Talk to us.
Yes, you know what, let me just ask, what is the work of public works? Because nowadays it seems as if just the main public works, the people who are doing public work is now the tenders, and those tenders are the ones that are causing dire situations in public institutions. People are getting money, a lot of money, but doing nothing in hospitals, in clinics, in schools, in all these public institutions. Now you tell the politicians to scrap these tenders, you are going to end up like Babita. Thanks very much.
Yeah, that is such an interesting question. Where does public works step into all of this? And perhaps a question for Minister Dean McPherson. Thank you so much for that, Anonymous. We're going to leave it there, of course, and it's been such an insightful conversation. I do hope that it does continue on X, though, at Newzroom 405. Thank you to Rich Sicina, who is, of course, President of the Health and Allied Workers Indaba Trade Union. And thank you as well to Professor Taolo Mokoena, who is the Health Ombudsman, speaking to us there.